their first shot before leaving jail, 91% of those 6 months later were still receiving their Vivitrol shots and still actively treating their addictions. This is what's bringing people back to jail. To educate people on the benefits of Vivitrol to those who do qualify, and also to just educate on Suboxone and all of the treatments available. To use this funding from Purdue to educate healthcare professionals, the funding that's becoming available, and changing regulations to prevent this from happening again in America. We really need to get to the table and be looking at prevention and how we can change things up. And healthcare is the place to do it. And as I brought up a little bit earlier, the Department of Justice is actually really setting the tone. And this was my newer research from when I wrote my first paper for Vivitrol, and then coming back for this presentation today. I did a lot of research in the last few months, and one of the main things I found is that the Department of Justice is addressing the opioid crisis, and one way that they're doing it is with Vivitrol. Vivitrol is favored in the justice system due to its inability to abuse, and its usage does not create another addiction. And so they're able to see its benefits. It's not the only thing offered, which many people are arguing against the justice system, that they shouldn't be offering one solution. They're offering all the solutions, and they are in the thick of it. It's a multitude of states are now addressing the epidemic upon us in drug courts, and that's happening right here in Massachusetts, in New Hampshire, and I saw some great articles from Chicago and other states throughout the country. They're using the federal money for Vivitrol-based programs, and that's coming from the grants. And as I said, the I-Team in Illinois had 279 started the shot, and 91% continued with treatment 6 months out. Those are powerful numbers. Another thing that is come out of the research, and we're starting to see, is Mass General Hospital started this program, and it's in efforts to also clean up our emergency rooms that were overloaded with the opiate addicts and overdose victims, and just people needing help in mental health and substance use. And so what they've came up with, a nurse care model for office-based addiction treatment for substance use and opiate use disorder. It's the Bridge Clinic for Mass General Hospital's program model, and it transforms care in order to ensure equitable, accessible, high-quality treatment. And we have a Bridge Clinic here. I don't think anybody's with us in this presentation today. They were invited, but we do have a Bridge Clinic here in Haverhill, and they are actively able to see people through recovery coaching and to recommend medication-assisted treatment and many other forms of treatment, whatever is needed. And so that is just a wonderful thing that Mass General is on the cutting edge. There's many different teams that I saw that they had. There's an ACT team, which is an addiction consult team, which runs through this model. There's ARMS, Addiction Recovery Management, and that's for teens and young adults. We see that today with the Leaving the Streets Ministry here in Haverhill. And there's a Hope Clinic, which is harnessing support for opioid and substance use disorder in pregnancy and early childhood. This is alleviating our crowded emergency rooms, and it's also giving people better access to nurses that are actually trained in what is the most appropriate treatment, and getting us closer to those standards of care that we need to see on an actual, a chart of who would better be served by Vivitrol, opiates, or use disorder, or Suboxone, or methadone. And so that brings us to a close of this today. As I said, in your package, you have a scale that is going to go over some of the main points. Hopefully, you've got a better understanding of medication-assisted treatment, what the 3 FDA-approved drugs are, Vivitrol, Suboxone, and methadone, and some of their differences. And I thank you for coming today.